Chapter 15, Schizophrenia, Spectrum, and Other Psychotic Disorders. Welcome to Chapter 15, Schizophrenia, Spectrum, and Other Psychotic Disorders. In this lecture, we will explore what schizophrenia is, the symptoms associated with it, other related psychotic disorders, treatment options, and nursing care for individuals experiencing schizophrenia. Learning outcomes. By the end of this lecture, you should be able to define schizophrenia, differentiate between positive and negative symptoms, identify two other psychotic disorders, explain treatment approaches for schizophrenia, describe catatonic features, and identify nursing interventions used when caring for patients with schizophrenia. What is schizophrenia? Schizophrenia is a serious psychiatric disorder first identified by psychiatrist Eugene Bleuler. The word schizophrenia literally means split mind. However, this does not mean multiple personality disorder. Instead, the term refers to a split between thoughts, emotions, and reality. Individuals with schizophrenia experience a psychotic thought disorder in which hallucinations and delusions can dominate their thinking. Characteristics of schizophrenia. Schizophrenia is a chronic and often debilitating mental illness. It most commonly begins between the ages of 16 and 35. And the first psychotic break rarely occurs after age 40. Schizophrenia is considered a spectrum disorder, meaning symptoms can vary widely in severity between individuals. Other psychotic disorders. Schizophrenia is part of a broader category called psychotic disorders. Other disorders in this category include delusional disorder, schizoaffective disorder, schizophreniform disorder, psychotic depression or mania, substance or medication-induced psychotic disorder, and postpartum psychosis. For example, postpartum psychosis may occur shortly after childbirth and can involve hallucinations, delusions, and severe mood disturbances. Knowledge check. Which statement about schizophrenia is most accurate? A, it is a disorder of frail elderly people. B, it can be diagnosed at birth. C, initial psychotic break often occurs in late teens or early 20s. D, it can become evident at any age. The correct answer is C. The first psychotic break most often occurs in late adolescence or early adulthood. Insidious onset. Schizophrenia often begins gradually, which is called an insidious onset. Early warning signs may include declining school grades, increased quietness, withdrawal from social activities, personality changes, and difficulty relating to others. Families sometimes dismiss these symptoms as just a stage. For example, a student who previously performed well in school may suddenly begin failing classes and isolating from friends. Common symptoms. 3 common psychotic symptoms are delusions, hallucinations, and illusions. Delusions are fixed false beliefs that cannot be changed with logic. For example, a patient may believe the government has implanted a tracking device in their brain. Hallucinations are false sensory perceptions. They may involve hearing, seeing, smelling, tasting, or feeling something that is not actually present. Hearing voices when no one is there is a common example. Illusions are misinterpretations of real stimuli. For example, a person might mistake a coat hanging on a chair for a person standing in the room. Additional symptoms, other symptoms seen in schizophrenia include echolalia, achopraxia, and catatonia. Echolalia is the repetition of words spoken by another person. If a nurse asks, "How are you feeling today?" the patient may respond by repeating the same words. Echopraxia involves imitating the movements of others. Catatonia refers to severely impaired motor activity. A patient may appear frozen, maintain unusual body positions, or remain in a state of stupor. Positive symptoms. Positive symptoms are behaviors that appear in people with schizophrenia but are not normally present in individuals without the disorder. Examples include hallucinations, delusions, disorganized thinking, and abnormal speech patterns. The term positive does not mean good. It simply means something extra has been added to normal functioning. Negative symptoms. Negative symptoms involve the absence or loss of normal behaviors. These may include reduced emotional expression, lack of motivation, social withdrawal, and difficulty forming relationships. A patient who once enjoyed social activities may now isolate themselves and avoid interaction with others. Causes of schizophrenia. Schizophrenia is now understood to be a brain disorder. Researchers believe it involves disruptions in neurotransmitters such as dopamine. Other contributing factors include abnormal brain structure or functioning, genetic predisposition, and environmental influences. Earlier, theories blamed family dysfunction, but modern research does not support that explanation. Knowledge check. Which statement about schizophrenia is most accurate? A, early treatment usually cures the disease. B, schizophrenia is a debilitating chronic illness. C, it is caused by poor parenting. D, it is associated mainly with post-traumatic stress disorder. The correct answer is B. Schizophrenia is a chronic illness that often requires lifelong management. Treatment approaches. Treatment for schizophrenia usually involves several approaches. Antipsychotic medications are the primary treatment. Patients may also participate in psychotherapy, family or group therapy, and supportive therapeutic environments. In severe cases, electroconvulsive therapy may be used. Long-term education and support are important to help patients manage symptoms and remain consistent with their medications. Antipsychotic medications. Antipsychotic medications are the main focus of treatment. Many patients must take these medications for life to control symptoms. However, these medications can cause side effects called extrapyramidal symptoms, or EPS. These may include tremors, muscle rigidity, and involuntary movements. Anticholinergic medications are sometimes given to help reduce these side effects. Nursing interventions. Nursing care focuses on safety, structure, and therapeutic communication. Nurses should never reinforce hallucinations, delusions, or illusions. Instead, they should respond with calm reality orientation. For example, if a patient says they see a snake on the floor, the nurse may respond by saying, "I don't see a snake, but I will walk with you to the dining room." Changing the subject can also be appropriate in this situation. Additional nursing strategies. Other important nursing interventions include building trust with the patient, maintaining a calm and structured environment, and communicating clearly and concisely. Nurses should state what behaviors are acceptable and explain the reasons and consequences, like staff should avoid whispering or laughing near patients who might misinterpret the situation. Patients should also be kept out of competitive or embarrassing situations. Conclusion: schizophrenia is a complex psychiatric disorder that affects thinking, perception, and emotional functioning. Although it is a chronic condition, treatment with medications, therapy, and supportive nursing care can help individuals manage symptoms and improve their quality of life. Understanding this disorder is essential for providing compassionate and effective patient care.